The greatest new innovation in facelift surgery is endoscopic mid-face lift. How does it work? The SMAS is the area that is between the skin and the muscle, and that's the area that we need to go to in the deep plane facelift, go down underneath to lift up. What's so innovating about the endoscopic facelift is with a very small incision up here, we can go down and get up underneath. That allows us to visualize the SMAS. What we can do then is one of two things: introduce the scope and then come in behind it with the endotine up underneath. This can be deployed while we're doing it under direct visualization. The endotine has 20 different prongs giving multiple areas of adhesion. I have had so many people respond to me on social media saying, "What, are you putting a piece of plastic in your face?" It's not plastic. It's a polymer that dissolves in about 6 to 9 months. Some of the other innovations are using these highly specialized needle drivers. You introduce this down underneath there because in addition to deploying the endotine, we can deploy a suture. And so the way we deploy the suture is you go in with the scope and then you go in with your needle driver and then you take this and you go down underneath this tissue. This is a very large needle for a point of demonstration. We do not use something this big in the operating room. And then that hooks into the underside of the SMAS. Once this suture is deployed, we bring this out and then you can pull on this and lift from up underneath. We use permanent sutures here, so this will stay forever. So this is what we call a belt and suspenders mid-face lift with endotine and the suture. So here we are with the endoscope, the endotine that I'm placing in here. I already have a guide suture in here, which is pulling the tissue towards me. Then I'm coming down with this endotine and then I'm deploying it underneath the SMAS. And so you'll see that the sheath came out, releasing the barbs, which will now be deployed up into the skin. That's the endotine aspect of the mid-face lift. This is how we do the dissection. We go in, we call this the platypus, and it's a very delicate instrument. You go in and you can do gentle spreading to separate and open up the tunnel as you're moving from the temporal region down into the midface. Again, I have my scope here and I'm doing very delicate dissection. This is high degree magnification. This is maybe 2 centimeters across here, blown up into very large magnification. So we have excellent detail as we do dissection. We're able to separate blood vessels from nerves, from ligamentous attachments to veins. And you can see we're doing very gentle spreading in here. Sometimes we'll introduce a needle through the skin and you can see it coming in right here. And that can really help me identify exactly where I am in reference to the skin landmarks. So here I am introducing that little droplet is lidocaine that is local anesthetic that allows me to deliver medication directly to the tissue so that this is a very comfortable experience for the patient. I'm introducing with the needle driver the suture through the soft tissue. So this is on the underside of the SMAS. Then I'm coming over here and grabbing the needle and pulling it through. This is a permanent suture that will be there. So you can see endoscopic mid-face lift is incredibly minimally invasive that allows patients to get a significant mid-face lift without any of the big incision. This is another one of our series to really bring you up to speed on what is the latest in facelift surgery in 2026. Hope you found this helpful. Thanks so much.